So today we'll be conducting a rapid COVID-19 test, and it's rapid because this test is performed within 10 minutes and result can be reported out in 10 minutes. The kit we're using is called Realy Rapid Test COVID-19. It tests for both IgG and also IgM. It's very fast, it's very accurate, and very easy to use. The kit contains 25 test kit. It has everything you need. Inside you will see 25 test kit, a lancet, an alcohol swab, pipette, capillary pipette, and also a buffer solution. And before you test, first thing you want to do is make sure you look at the kit and it's still active. The expiration is March of 2022. Test is still accurate. This is one of the few tests that FDA Registered that's currently available on the market here in the US. So I'm going to go ahead and get started. I have with me here. First, you want to, of course, don protective equipment. Your gloves on. I would remove the test kit from the package. Inside there's also a desiccant to keep the test dry. Here is the sample well. This is the reading test. The test technology is called lateral flow immunoassay. So it tests for antibodies inside the body. There are three markers. First is the C. The marker C stands for control. And then the IgG, which is immunoglobulin G, and also IgM, immunoglobulin M. Wherever the marker shows up will be respective to the positivity of the test. You should always see a line through the C, and then if there's a line through the M or the G, means it's positive respectively for IgG or IgM. I'll set this on a clean piece of napkin, and I'll go ahead and label the name of the person getting tested. So I have here Manny, and I put today's date, which is the 10th. Okay. So this test can use sample whether it's from whole blood, human whole blood, serum, or plasma. So any of those specimen sources acceptable for testing. So I have the test here. First, you select the site where you want to get the whole blood sample. So recommended is either the middle or the index finger because it has more circulations. So I'll pick the middle finger for this testing purpose. Open up an alcohol pad. Now you want to wipe away and try to get the site as clean as possible. Be sure to let the alcohol dry before you actually start to collect the sample because you don't want the alcohol to interfere and possibly produce a false negative. So I'll give it 15 seconds to dry. In the meantime, I set up my lancet. I have my pipette, I have my buffer solution. So the first thing I want to do is kind of express the blood from the distal to from proximal to distal. Locate the site. Usually the palmar aspect is the best. Place the lancet on top of the finger and just press down. You should hear a click, as you can see. So you want to collect 2 drops of blood. Dispense it into the well. Okay, that's 2 drops. Remove the top sheet. Stop the bleeding. Put pressure, please. And then the next thing I want to do is dispense vertically. Drop one drop of buffer solution into the sample. Then you want to set your timer for 10 minutes. You want to be able to read the test within 10 minutes and no more than 15 minutes. So at the end of 10 minutes, as you can see, there is a clear a distinct line across the C marker, which indicates the control is valid. There's no color line across the IgG or IgM. So both of these tests are negative for COVID-19 IgG and IgM.